So today I am going to tell about a study for male androgenic alopecia, and I have already made a video in Hindi about this. Today we are just repeating the facts. The study was conducted on 27 patients. Why I am saying that sample size was 27? Because a small sample size means study needs more evidences. In this case, the carbon dioxide laser is studied over the scalp for male androgenic alopecia, and they conducted this CO2 sessions on half scalp. So just to compare in one person, that if half scalp is treated with CO2 laser, is it showing more hair growth on that side? And then they have taken baseline photographs, and this baseline photograph is assessed by three independent dermatologists who were blinded, means they were not knowing that which area of scalp is treated. Secondly, they have taken dermatoscopy photographs that we also do in our clinic as baseline. Dermatoscopy or HAT test is to assess the density of hair over the scalp and the thickness of hair. You can measure the thickness of hair also. The dermatoscopy measures the count in a 1 centimeter square area, and then we can calculate, if we know the surface area of all over scalp, we know the count of hair all over the scalp. And the third thing they did was to do electron microscopy to see the different phases of hair. The telogen hairs are shorter, they are smaller, and anagen, the growing phase hair roots, are bigger in size. So they compared that whether the telogen shafts are less, or whether there is a telogen anagen shift is happening after the CO2 session. So the final conclusion was that CO2 laser is working very well. There is not only increase in density of hair, but the thickness was also improved. And same individual, the half scalp which was treated, was showing more hair growth, and this study was followed up for 4 months, and every month CO2 laser sessions were given. The disadvantage of this study was that you have to shave the scalp every month to get the session. So practically this is not possible for females, but for males it's showing promising results. So the study was also conducted on the male patients, and finally the final conclusion is that CO2 laser is working in male androgenic alopecia, especially for those patients where only medicines are not working, or if PRP is not showing good results, we can opt for carbon dioxide laser. How this carbon dioxide laser works: it creates the columns of heating inside the scalp, and these columns, the tissue injury around these heated columns leads to more growth factor in those areas, and these growth factors stimulate hair stem cells to make more hair. So this is the way it works.